Hi everyone, my name is Jonathan. I'm the QFR support specialist here at Medis. Let me show you how to find the correct analysis frame in both left and right circulatory systems. Here I have a standardized case of the right coronary artery. If I open the QFR application, the images are loaded and we can start to perform our analysis. We have to confirm nitro and then find the correct analysis frame. Now we see that in this case the patient has ECG registration. If this is the case, you will find that the software recognizes the end diastolic frames for you. You can either click on it to select, you can scroll through the images, or you can skip to the next end diastolic frame with the best contrast view. In some cases, you might not have ECG registration, or it can be corrupted in the information. There are some ways to find the end diastolic frame manually. So some tips for this are to look at the coronary cusp, or the flow of contrast around the ostium of the coronary artery. Once you see contrast leaving into the aorta, it's usually 1 or 2 frames back. You will find your correct analysis frame. On the right hand side, it's illustrated as well. You see the contrast leaving into the aorta. You go 2 frames back and you're at your end diastolic frame. On the right coronary, there's also an added benefit of having the distal bifurcation. You will notice its angle increase at the moment of end diastolic frame. So when we go to earlier frames, there's a slightly more acute angle between the 2 distal branches. Once we reach the end diastolic frame, which is the next frame, you'll see it start to open up to a more obtuse angle. Once you see this first opening of the angulation, that is the end diastolic frame. So also in the other projection, there's a very acute angle, and at the end diastolic frame, it starts to open up to a more obtuse angle. Those are some of the tips for the right coronary artery. Now let me switch to a left coronary system. Now here I've loaded a left coronary case with the LAD, the circumflex and some diagonal branches. We need to find the end diastolic frame again. Now we see we do not have ECG registration for this patient, so we need to do it manually. The same tip applies to look at the contrast near the ostium of the LAD or the left main to see where the contrast is leaving the coronary cusp, going into the aorta. Once you see that ejection, you go 2 frames back, 1, 2, and you're at the correct end diastolic frame. In this case, that's frame 25. So let me zoom in on the other image. Let me see the same, and do some windowing. Here we see contrast in the coronary cusp. We see it leaving into the aorta in this frame. So we go 2 frames back, and by coincidence, this is also frame 25, which is for this patient the end diastolic frame. One other tip that you can look at is just the position of the coronaries themselves. Once they're stretched out and relaxed, then there's no systolic action going on, and we can assume that it's the end diastolic frame. So during systole, you see more bending of the vessels, more contraction, and at the end diastolic frame, they're nice and relaxed and in a stretched out position. In some projections, you might even look at the left main artery and at its highest position. So let me zoom in this case. Note this is the end diastolic frame, frame 25, and this is the highest position of the left main artery. If I place my cursor on this location and scroll to other images, we see that the position is a lot lower in those other cases. So both before and after the end diastolic frame, the position of the left main artery is a lot lower. This works in most cases, but unfortunately not in all. If we look at the other frame, there are a number of frames where the LAD or the left main is at its highest position. So in summary, there are some tricks. Look at the position of the left main, the position and orientation of the coronary arteries themselves. Look at the coronary cusp that works for both left and right coronary cusps. And in the right coronary artery, look at the angulation between the distal two branches.